Hey guys, Dr. Taylor Premer here with Winchester Spine and Sport. Getting helped out today by Dr. Tyler White behind the camera. Today is our second day for TMJ dysfunction. Okay, so yesterday we did a little bit of an overview, just kind of what the main causes are, what are some of the issues that we're working with, and that kind of stuff. So today we're going to talk about the musculoskeletal side of that. That basically means what we can do with our hands through manual therapy, and then through adjusting all sorts of other stuff that can basically affect the joints and the muscles surrounding the temporomandibular joint. Okay, so one of the big things we talked about yesterday was trigger points and muscles of mastication, or the muscles that control the jaw movement. Trigger points in there can cause referral patterns that are kind of weird. For example, a trigger point in the masseter here in your jaw can refer up to your ear, or even more distally, something in your sternocleidomastoid muscle down here can refer up to your ear. And so our goal with our soft tissue assessment is to try to find those trigger points that are causing that pain, or causing your headaches, causing the clicking and stuff like that. Remove them, and then try to groove the motor patterns as we kind of talked about yesterday. The other main component, so Dr. Jeffrey Okeson is kind of like the main, the expert in the world as far as temporomandibular dysfunction. One of his best quotes is that you rarely see a temporomandibular dysfunction without cervical spine dysfunction. And so usually, since there's tension in here, it's because we're not stabilizing properly through our neck, and then also leads us back to our DNS minds of not using our diaphragm correctly in respiration, which is putting lots of tension kind of in the upper part of our neck and then up into our jaw. So those are kind of the main components that we're looking at. We're going to address them using our manual therapy, our palpation skills, a little bit of pin and stretch, maybe some acupuncture if needed. Then we're going to use, make sure to clear out the cervical spine to make sure that there's no referral pattern, maybe from a cervical disc or some other facet issues that it could be referring pain up there. And then the last thing that we're going to do is just make sure that everything is kind of grooving together perfectly, which is going to be usually some take home with some mouth opening exercises that kind of just reassure and reassure the pattern. So just to review, so if we do find soft tissues involved with the TMJ dysfunction, we're going to address them to get you out of pain first, but then we're also going to kind of dive deeper into figure out why that's there in the first place. That could include some cervical spine adjusting, that could include some diaphragm activation or DNS in those positions, and then the last thing is to just ensure that they don't come back. So hope you guys enjoyed the video today. Tune in tomorrow for a little bit more on the dietary side, some of the issues that we can have with food sensitivities playing into temporomandibular dysfunction. So thanks guys.